call. Okay. So welcome in. If you're here, the general assumption is that you might be a caregiver in the medical world. And so I wanted to ensure that during these open forums, we reserved at least one lecture per year to really focus on what I call the other person in the room in a healthcare setting. So this open forum is December. Even though we're a little bit late, November is National Family Caregiver Month. That was denoted that in 2008 on a federal level. And then I believe just a couple of years ago, or quite a few years ago, maybe, the state of Idaho also, repeated that and reinforced that National Family Caregiver Month through the state of Idaho. So what that means, in essence, is that there is more of an awareness garnered around resources for caregivers and money. There's more money available and accessible to caregivers through that month. So again, I know we're a little bit late here. November wasn't my month to lecture, so I wanted to make sure that we addressed it today. So just a quick introduction. This is a bit confusing, as we kind of chatted about before we started recording. This is a caregiver open forum that is scheduled. We have scheduled monthly open forums here through the clinic, where one of three of us doctors will be lecturing on a specific topic to help educate and empower our community. And this topic is caregiving. On top of that, I had decided to host the first caregiver support group here at the clinic that was scheduled to be last Wednesday, that ended up getting canceled due to the big snowstorm we got here in Coeur d'Alene. So it got rescheduled to tonight. So we are meeting tonight in person here at the Coeur d'Alene Healing Arts to have a caregiver support group, which will look different than the open forum today. And it is open to the public. And like I said, it is in person. But today's open forum is really more to share information and support and advocacy of the caregiver role, and how to really support, like I mentioned before, that other person in a healthcare setting that would not be the primary patient. Typically in a lecture like this, I really do appreciate, any contribution or participation. That we have two people live here today. If you feel the need or the desire or have some questions specific to your situation, really feeling comfortable to do that. Again, a reason we're doing this in person tonight is to have a more intimate setting of sharing and supporting. But for today, it's really, I want to speak and I want to lecture and give information, but more than anything in these open forums, we want to be accessible to the community to be able to ask questions and get some more support. So before I dive in, do either of the live participants have any questions or anything that you really want to make sure we're hitting on today?
No, I'm just really thankful that you're offering anything like this, because I've looked for caregiver support groups, and even hospice has nothing right now. I feel like COVID devastated local support. So I'm really thankful for any information as well as any interaction that you offer.
Oh, great. Well, I'm so glad to hear that. Thank you for saying that. It is really so important in COVID. Whatever was there to begin with, which it honestly isn't just much, it definitely did take a hit through the pandemic, and we're starting to see a reemergence. And I want to talk a little bit about another resource. It is cancer specific, but a good friend and colleague of mine, Eric Schubert, is working at Beacon Cancer Care, and they are on Facebook and a website. And he is also beginning a caregiver support group on a monthly basis. And this is just for cancer caregivers, but really, really important niche to be filled. So that's another resource that I hope people will look into if they're filling that role. So I'll go ahead and get started, just kind of chatting about why I'm here, why we're talking about it. I'm a naturopathic doctor here at Coeur d'Alene Healing Arts. My focus is integrative neurologic health. And my passion in getting into healthcare, which I'll share a little bit, is because of my experience in caregiving as a person. So just start chatting a little bit. Again, this is totally open, so anybody can jump in, ask a question, share, redirect, however this works. So it doesn't have to be organized. So my story, just wanted to share a little bit of my story. I was 14 years old when my dad suffered a pretty devastating seizure secondary to a brain tumor. And at 14, it was just this really, really huge event in my life where I showed up with my mom to kind of navigate the medical system. She was a nurse and helped support my dad in his health journey. Just a couple of years later, my parents actually did split up. So I became the primary caregiver for my dad. And by the age of 17 or 18, I was able to navigate the system. I knew his med lists. I knew his allergies. We had been to the ICU multiple times. It was just one of those things that became ingrained in my life very naturally. And through the whole thing, I really just considered myself a really good daughter. I just, I'm one of 3 girls. So, I like to joke and say I was the favorite, but really, I just always felt like, hey, I'm just being a really good daughter. I'm taking care of my dad. This is what anybody would do. And I did this for over 20 years. So I went to college, I joined the military, I went to medical school, I got married. And through the entire course of my life, the thing that really drove or pivoted my decisions was my dad's healthcare. We spoke on a regular basis. I managed his medications, even on deployment, his appointments, everything that he did with his physicians. And again, those really frequent emergency room ICU trips that would happen on a regular basis was something that I would manage and take care of. Again, feeling like I was just a good daughter. About 6 years ago, my dad suffered another seizure, and this time it was quite devastating, and he ended up losing his memory as a result of it. And so what I like to share in this realm is I was really just a good daughter until I wasn't, until that relationship was fractured just because of this situation of losing of the memory. And in losing that role as a daughter because of memory loss, I also recognized in this giant transformation in my life that I also lost this huge purpose in my life, and that was as a caregiver. It was very disorienting. It was very challenging, really life-shifting. I was already in medical school. I was already on track to practice in neurology because, my passion for the brain was born at a very young age. And then having this realization come of, everything that I thought to be true of my role in life was really not, and never had any support through any of those, 20 years as far as how to navigate that and what to do. So lots of advocacy, lots of fighting, lots of tears, lots of exhaustion, and learning that as a physician, I really wanted to make a space for this type of medicine because this is where it matters. And we'll talk about that a little bit more. So resistance to the word, I do want to address on that. Caregiver is a really challenging word for a lot of people, whether you're a child and you're just a really good daughter, whether you're a spouse and you're just a really good wife. This is part of my vows. I hear this all the time, whether you're a parent and you're just parenting. When you read caregiver in the dictionary, it's a family member or paid helper who regularly looks after a child or a sick, elderly, or disabled person. So you are that, and right, you are a daughter, and you are a parent, and you are a spouse, and I think the more likely we are to adopt another title, the more likely we are then to balance those roles in a way that's healthy for both the relationship and the health journey of the primary patient. We'll talk more about that as we move on. So there are, definitions. You require a minimum amount of care and what kind of level of impairment it is, but truly, when we talk about caregiver support, it is somebody who is providing the primary care for a loved one or a beloved one within the home or, through even long distance. And I have noticed so often in the caregiver support groups I, provide and the lectures that I've done and the amount of work that I've done in this field over the course of, the past few years, so much resistance. So it's, caregiver, carer, caretaker, care partner, everybody really prefers a different title. And I want to respect that for each person. I'm going to use caregiver for the intent and purposes of this lecture. But again, if we're working one-on-one and there's a different title that somebody prefers, then I will always honor that. In reality, we come away from that dictionary definition and it doesn't just, a minimum number of this and a level of impairment. It's juggling doctor's visits and keeping track of medications and managing moods, spending endless hours worrying about their loved one's health and future. And then also feeding, listening to, reassuring them, helping them with chores and activities of daily living, paying bills, running errands, helping with yard work, fixing leaky faucets. And the list goes on and on. You know, each individual journey can probably add at least 10 to 15 more regular daily duties that is asked of them in a caregiving role. Even more real aspects to being a caregiver include the mental, emotional part. Are we isolated? Are we depressed? Are we lonely? Is it helpless? Is it confusing? Are you exhausted? Guilt and relief, I put those in the same bullet point because often those go hand in hand. We feel guilt about the relief, and then we feel relief in moments where we might feel a little bit guilty as well. So oftentimes I hear that those things go hand in hand. Anger, fear, anxiety. So many of these mental emotional components are involved in being a caregiver for somebody that aren't really addressed in any way, shape, or form. So welcome into the call, Nancy. Just want to pause here for a moment. We did get started a little bit, but I'm Dr. Karin. This is the Caregiver Open Forum. Later tonight, we are hosting a caregiver support group that is in person here at the clinic. So if there's any confusion there, that's where that lies. This has been scheduled for months, and the caregiver support group got rescheduled from last Wednesday. This is an open forum. So I'm chatting right now, just because nobody else is, but I do really want to open up the opportunity. Anybody can chat in the chat window. You can raise your hand, or you can just unmute yourself and ask a question. So welcome in. So grief is a really key point that I want to talk about here. And then again, it's really going to be the core tenet of our support group tonight. And I just really love this quote. A dear friend of mine actually wrote this after she lost her husband in an aviation crash shortly after she gave birth to their fourth child. And she said, you know, we never see it coming until it's our story to live. It's a guaranteed part of living a life of love, a deeply embodied human expression of gratitude for what has been. And I think when we think of grief and we define grief, there's so much negative words and emotions that we attach to it. And truly, it can be one of the most intimate experiences that we get to go through, to experience. And it rarely is that intimate or beautiful in real life. And I see that every day in my practice when we work with the death and dying, when we work with the terminally ill, when I work with neurodegenerative disease, because there's so much else muddled into it, you know, from the previous slide. So a really huge goal and passion of mine in my work with caregivers is how can we get to the point where the grief, whether the person is alive or not, can be so beautiful and intimate and lovely in a way that feeds your soul instead of is really enmeshed with all these other really confusing emotions. Grieving the living. If we're caregivers, then our person is living currently. And so there is a term called ambiguous loss. Again, that is going to be the core tenet of our support group tonight. But really, even before a loved one dies, it's common for caregivers to experience grief, sometimes on a daily basis. And that grief can look a lot of different ways, and we'll chat about that in a couple slides. But I think it's a really understated emotion that happens when you're in a caregiving role. It's definitely one that I never acknowledged in my own personal journey, and really wish that I had, because years and years after the shift change and that amnestic state took hold, I'm still processing so much grief from the 20 years prior that I never took the time to acknowledge as I was going through it, and didn't, you know, hold myself in my heart tenderly enough to say, yes, he is still living and you're still caring for him, and here's what your relationship is, but here's also what you lost. And again, we'll chat more about that a little bit. Losses and gains. We talk about this a lot. You know, what has changed in the caregiving role? Is it a personality? Is it their sense of humor or their temperament? Is it physical? Do you not get to go dancing anymore or go on dates? Have they lost their ability to cook or strength? Have you had to take the keys away from a loved one? If anybody's had to do that, we know that can be one of the most traumatic events in a relationship. jokes. I've heard things, like I've just grieved that, he used to have this, or she used to have this twinkle in her eye. And I feel like that's gone a little bit with the facial expression, or they don't smile as much. We're not as intimate. There's not as many hugs or kisses. So when we really stop to think about grief in a relationship, in a healthy relationship between two people who aren't fighting a disease, there's going to be griefs, right? As relationships mature and change, whether it be between partners in a marriage, whether it's between a father and a daughter, whether it's between a mother and a son, either way, all of these relationships ebb and flow over the course of time, and there's these little griefs. So regardless of the caregiver role, it's a really important fact to acknowledge in a healthy relationship. What has changed, right? What are we grieving? What has shifted for us, and how are we embracing the new? In a caregiver role, it tends to be a little bit more one-sided. We're losing these things, and we're experiencing this grief and loss from our loved one. And meanwhile, really having to either overcompensate or compensate for that, or just adjust and adapt as we go without really stopping to spend time on that and process and even give it a name. So some of the personal losses and gains that I wanted to share, so everybody can then kind of reflect on their own process, is, one of the best things and favorite things I used to do with my dad was to play basketball. I mean, we had a dirt court out back, and it was just a passion of ours, and we could find each other in the gym, all the time. After his brain tumor and subsequent seizures, he lost a lot of his vision and coordination, and I became a full-time seeing eye guide. And why I smile about that is because, grieving the loss of that sport was so enormous for me. But even now, 25 years later, after this started, I still can't walk on the left side of my husband down the street. It drives him nuts, right? It's just, I have to be on the right side. I have to make sure he's not running into anything. And he says, Karin, I can see. I'm like, that's fine. This is part of me now. I've become a seeing eye guide, and I want to be on your right side. And I feel very purposeful and intentional about how that has become me and why that's part of my story. Sharp and clever wit, the banter, the jokes, the humor, that type of relationship that we had, coming from the North Midwest, there was a lot of it. What that then turned into, because he did lose a lot of his vocabulary, that wit, that behavior, and his ability to do word recall, what that actually turned into is that he would say something funny, but it would be using different words that nobody else could really understand. And because I had spent so much time with him one-on-one, that even through the cognitive changes, I was able to really understand what he was getting at. And they became these inside jokes that, again, are still really alive and well right now between, my sister and I will laugh about them, where I just have those as memories to say, hey, we lost a lot of that banter, but really I have these inside jokes that I know only I understand. A safe driver, every parent at some point in time plays, driving Miss Daisy to their children. And we traveled all across the state of Michigan to, basketball tournaments and whatever may be, school and recitals and trips and family trips and things like that. And instead of being carted around or having him come visit me in places that I went, it ended up being, I had to go fly to his home, and then we would take these road trips together. So I could drive. And one of my fondest memories is actually moving across country and being able to take that road trip together and crossing items off of his bucket list as we went. So again, it doesn't mean I'm not grieving the things that were. It means that I'm able to shift my relationship into something that is really meaningful. Again, stoic father figure. I had this wonderful, stoic, strong, athletic, masculine father figure that was very reliable and knew how to fix everything. That then really shifted into this very vulnerable and emotional, labile man who allowed me to understand the depths of masculinity and how much more I could hope for and expect for in a future partner, and different conversations than I felt safe to bring to the table with my dad. So again, just kind of sharing a little bit about my experience so that people can reflect on theirs. Childhood and adolescence, I grieve that. I was 14 years old during the first medical trauma, I will say. So from 14 on, it really shifted how my childhood looked into this caregiving role and being very responsible for my dad's health. And that led me, to sitting where I am now, as far as having this lifelong passion for healthcare and advocacy, recognizing when somebody is serving that role and trying to help balance those responsibilities with their current experience. A purpose, I mentioned that a little bit earlier, that when I did lose my dad to the amnestic state and lost that relationship as a daughter, I also lost my purpose as a caregiver and was really lost and floundering for a long time. And what did that give me at the end of the day? That's a purpose. A new purpose is, hey, how can I help other people see that their title is so much more than daughter, spouse, sister, husband, brother, son, whatever the case may be, and that there's much more purpose to be had once we really acknowledge and invite that term caregiver into our life. How and why should we be embracing this new role now that I've introduced the fact that you do have a new role, that you are more than? What I want to say is, sitting in this seat here in my clinic, if you've been to this clinic, it is very intimate and lovely. More often than not, I see patients come in without somebody else, whether it's memory issues or cognitive decline, Parkinson's disease, stroke, whatever the case may be. They're coming in on their own. And why is it important for you to hear that? It's because it is an and. This is not the expectation. This is not the norm. And we use the word burden a lot as such a negative terminology. I don't want to be a burden on somebody. I don't want to be burdensome. And so typically the caregiver actually takes that on in a very heavy load, because not only is it actually a burden, but now we have to reassure our loved one that they are not a burden and act like it's not, right? You're actually taking on double duty to say, I'm being asked to do more, and I have to pretend like I'm not being asked to do more. And I think when I have these conversations, when people actually are in the room with me and we redefine what a burden is, and we kind of reestablish that relationship with that word and what that means, and how and needs to be a part of our vocabulary when we take on a caregiver role, and we embrace and invite that role into our life, it actually enhances the relationship between the two people, which then decreases stress and anxiety, which leads to lower inflammatory markers and better cognition, and more energy for the first role you have, right? We're gonna have more energy as a daughter or a husband if we're not always worried about not making somebody feel bad about being a burden, than if we were just like, hey, yeah, now I have to do this too, and this is a lot, so I'm going to get this done so we can spend time together. And just being really open and transparent and communicative about what that role looks like. So again, what's your superpower? Like, if you are showing up as a caregiver and in a relationship, if that is something that you're doing, then you have a superpower. And recognizing that as extra and extraordinary is so important in how we're navigating this world. And there's the psychological benefit, which leads to the physiologic benefit, which leads to family resilience. And I'm going to go through this in a slide and actually show you the data on it. But recognizing that if you can take it from me, not everybody has one of you, then you start to recognize that it is a superpower and that it is additional, and that doesn't mean that it's negative. So why does this all matter? There are 5 tenets of resilience. This was one of my passions, and I actually published a paper back when I was in medical school about resilience in cancer survivors. And the 5 tenets is stress and coping with, goals, purpose and planning, optimism, gratitude and meaning making, and connection and belonging. When those 5 tenets are in place, then we start to really create this resilient being who is adaptable and flexible and able to take on more, which doesn't mean that it's not heavy, but able to handle and adapt with it. It also means that they're more likely to ask for help, delegate, and prioritize in a way that's more effective for the roles that they do. Oftentimes we'll see people taking everything on and meeting some of these tenets of resilience, but everything is this equal urgency. And that's when we really recognize that somebody is in that fight or flight mode. running from a bear. Every single threat to their world is a bear, and they're responding in that same intensity to every single one, rather than be able to prioritize or have a hierarchy of tasks at hand. And as a caregiver, the common phrase, burning the candle at both ends, often leads to that. Just have to do everything all the time, no matter what, at this fast of a pace and this intensity level, which really does lead to burnout. And when we have that resilience factor, when we have that ability to use the prefrontal cortex of our brain and not operate through the amygdala, which is that fear center, we actually have the ability to stratify the tasks at hand and what we're doing. And so often we're put into that fight or flight mode, like I mentioned before, because we're working so hard on an emotional level to not acknowledge that it's more. We're working so hard to just be one role, and this is what's expected of me, so I just need to do it all and wrap it up in one little bow, that when we actually make space to recognize that it's more than that, our nervous system can settle down and start to operate at a more effective pace. Determinants of resilience, of course, this slide is actually a really personal one for me. Again, coming from Michigan, the crocus, when they bloom, it's always just one of those amazing nature miracles, right? There's still ice and snow, and you're just coming out of these long winters, and you see these beautiful crocus, and it's just like, oh my gosh, it's coming. we can see the light at the end of the tunnel, and they're just so damn strong. They come up, through the ice and the frozen ground, and it's just such a symbol of like hope and optimism there. But determinants of resilience, of course, we have some biologic resilience. How good is your DNA? What's your genetic and epigenetic predisposition? Developmental, what was your mother's health like? What was your grandmother's health like? What was your childhood environment? Did you have clean air and water and fresh food? And those types are definitely going to contribute to a person's resilience. Physiologic, of course, there's neural, hormonal, immunologic. How resilient are we to pathogens? There's a ton of research obviously coming out through the pandemic on this. We coined that the terrain theory. We can all be exposed to the same pathogen, but how we respond to it is independent of each person's internal terrain. There's social aspects and determinants to resilience. Demographics, social economic status is a huge one. There's a lot of research out there showing there's elevated inflammatory markers in populations that are raised in a lower socioeconomic environment. And then cultural, are there values, are there goals? Is there a faith-based practice? Is there support on a cultural level? Is there understanding and belonging? And those all contribute to a human's resilience. Again, why is this so important? Patient resilience. When we're talking about the primary patient, the person you are caring for, their resilience and how they adapt to and respond to disease is directly correlated to the health of their caregiver. So it's really fascinating to see people literally burning out their own health in an effort to keep this person functioning. And while it may look that way on paper, their resilience and their ability to take on more is lowered when the caregiver health suffers. When you look at some of the data, over 40% of caregivers indicate that their health suffers as a result of caregiving. Almost half had increased depression scores, and 2/3 reports that their social life suffers. And we just saw 2 slides ago that community and sense of belonging and isolation are direct contributors to a person's individual health. Caregiver burden increased with increased disability and symptoms of Parkinson's disease. So in this study, we're looking at Parkinson's disease. Of course, as the disability and symptoms get worse, then caregiver burden is also increased. And again, if we're not acknowledging that word, if we're not acknowledging the extra that's put into this role, then that's really going to take a direct hit to our health. Caregivers, in particular spouses, also had severe depression, higher proportion of reporting tiredness, sadness, and less satisfaction with life. So these are really huge components of individual resilience and health that now we're seeing are directly correlated to the primary patient, the person we're trying to take care of, their health picture. And again, the two-way street part here is that caregiver health is also affected by the patient resilience. So the more that patient can take on and do independently, and that vitality and strength, the VEAS, as we say in naturopathic medicine, the more that's going to contribute to caregiver health. So again, key determinants of resilience is the amount of social support available. We chatted about that before we got on the call. There's not a lot for caregivers right now. We're really trying to shift that. And again, we're offering the support group this evening. Again, this seems really silly, but they did a study and they said, yeah, caregivers of cancer patients revealed that they, in order to provide adequate support, they too required attention. I don't know how many people, I've been there 20 years, you sit in a room with your primary patient and you never once get addressed. How are you? What's happening? How is your health? How can we support you? What do you need? Do you have resources? It doesn't happen. And advocating by that point in time, oftentimes caregivers get to a medical appointment, right? What do we do? Tune out and relax sometimes. Hey, somebody else is going to take care of my person. They're going to be talking to the doctor. This is like my one kind of break where I kind of have to be here and know what's happening, but I also get to just like relax and tune out. And that can happen sometimes, but really what needs to happen is you need to be engaged in that. And the provider needs to be engaging too, to say, what can we do to enhance both of your health pictures? We've already talked about that. Level of burden for principal caregivers needs to be addressed, so then we can promote individual resilience and ease the caregiver's burden. Maintaining an intimate and separate relationship with caregivers as providers. Again, allow nurses to see the need for differentiated care for caregivers. So again, we need to be providing care for the caregiver that's different than what we're doing to the primary patient. Hey, how is your health? What we can do to support you, and what resources are available for you. How does this all tie together? We've talked about it. Here's a picture. Everybody likes pictures. Individual resilience breeds family resilience, which breeds better patient care, which reduces the caregiver burden, which improves the patient prognosis, which then improves individual resilience, right? So it really is a cycle that can self-perpetuate. The really hard thing to do, right, is I would like to say, where do we throw the stick in the spoke of the wheel? Where do we interject? And from my seat as a physician, it's really at patient care. How do I sit here with the primary patient and offer good supportive holistic care to them and their care partner individually and differentially, so that we can then help relieve that caregiver burden and improve their prognosis. We hear this all the time as caregivers: put on your own oxygen mask before assisting others. You know, really answering these following questions are going to be important. I don't know if you can see this, so I'm going to minimize that. Answering the following questions, yes or no, is a really quick assessment of how you are doing. Are you getting 6 hours of uninterrupted sleep most nights? Do you have a period of alone time every day? Is there somebody that you could or would phone if a problem arose at any time of day or night? Is there somebody in your circle of family or friends who could help with financial needs if there's hardship? Does somebody else in your life fully understand the day-to-day trials you experience? There are so many people that I see on a regular basis, and I talk to the care partner. And again, because my primary condition that I treat is Parkinson's, I say, hey, do you have support? Yeah, I've got my sisters and I've got my friends, and you know, I'm doing X, Y, and Z. I said, are you part of a Parkinson's caregiver support group? No, then you need to be. Let me connect you with another partner that's available, because this particular journey is so intimate and individual anyway, and everybody's is, that finding somebody that at least can relate helps with that isolation piece and keeps you connected. And again, regular planned breaks, mini holidays away from caregiving responsibilities. All of these things are things that, you know, our loved ones are telling us to do. Take care of yourself first. How do you actually do it? How do you find more yes? Preparation, having open conversations with your care partner, inviting in a physician to have these conversations with you, to moderate, to help guide them. Consider changes that make your home safer for your loved ones so they can have more independence. Bringing in professional help if possible, finding online or in-person support, trying to create time for yourself, exercise, and sleep. So again, all of these things that seem like more to do in the midst of this chaos of being a caregiver actually breed better health and wellness for you, which results in better health and wellness for your primary person. How to get there is not always easy. We do have resources available. Again, communicate with your loved one about the task they may be able to do solo, and then honor this. When I first gave this presentation, I was pregnant, so I did not have a child yet. Now I have a 3-year-old, recently 3. And I like to liken this to, putting on shoes. He's in the phase now with like, I do it myself, I do it myself, I do it myself. And while it would be so much easier for me to put on his shoes for him, what I'll do instead is say, hey, we're going to leave in 10 minutes. It's time to start putting on your shoes. And instead of that creating more work for me and also more frustration for him, we create that space and time and planning for that to happen. Similarly, with somebody with Parkinson's disease, what I often say is if getting the mail as a task that they can do and walking to the end of the driveway and back takes them 30 minutes and it would take you 2, then enjoy the 30 minutes alone and have your cup of coffee while they walk out to the mailbox, get the mail and bring it back. It may be slow, it may be different, it may be challenging to watch. And also there are ways to be creative about your time in the day to try to make sure that you're getting that time to yourself. Physician advocacy. This is really directed at physicians, right? We have to be able to recognize and enhance caregiving when it shows up to us in the clinic. It's a really challenging task for healthcare providers sometimes to find the time and the resources. It just has to be a priority. Again, I've already shared all of the data. In a way that patients can do this for themselves is, again, advocating, saying, making space at the end of the visit. I've made my list for my primary patient. I need help. Do you have resources? Please connect me somewhere. And really pushing hard for that when you meet with your physician. Really trying to encourage physicians, when I talk to my colleagues, can you recognize resilience? Can you identify traits and vulnerabilities? So then we can allocate the resources effectively. Maybe somebody does have a great support network and a team of people and they're in support groups. Hey, don't give them the name for another support group then, right? Maybe hook them up with a massage therapist, maybe set them up with something else that would be beneficial for their health and wellness and being able to recognize what those needs are. Again, cultural metaphors like battling disease can really influence honest patient communication about the mental health struggles. Not everybody wants to hear that they're in a battle all of the time. So again, physician awareness and even caregiver awareness. How are we framing disease and how does our patient want to chat about it? I've had cancer patients in here say, I'm in the fight of my life, and that's really how they want to approach it. I have other patients that say, I really want to live with this condition and I want to invite it in and embrace it. And I still want to be cured of it, but they're approaching this disease much different. So understanding how each person feels unwell is actually really important to how we need to treat that person. And again, approach the caregiving dynamic. Resources, these are somewhat direct. Oh, there's got Spokane Cares, Spokane Kinship Caregiver Support Group. There's a lot of different resources out there, but really in the background, what you see is 211. And what I like to say is 211 is the 911 for caregivers. Countywide in the United States, if you dial 211 from a landline or you go online and you Google 211 for your county, you will come up with either the Area Agency on Aging or a caregiver resource network that will walk you through all the different resources in your area for respite care, for financial concerns, for physical therapy, occupational therapy, speech, whatever the case may be. It's this hub that allows you then to be directed to what you need. My recommendation is always to call. Number one, they hire the most lovely people to work at these call centers because this is their job, is to really recognize that they're helping these people whose cups are full and direct them to where they need to go. And then also, instead of making 5-6 phone calls to find an answer that you need, again, we've already talked about the fact that caregivers are burnt out. You make this one call, you say, here's what I need, here's what I'm experiencing. They say, here's what you qualify for, here's what's available to you, and here's what would best serve your purposes. So it's a really phenomenal resource. I can say that professionally, personally, I've used that again, doing long distance caregiving for my own dad from Seattle. I was able to set up respite care, in-home care, physical therapy from Seattle to Michigan by using the local 211 resource network. So it's a really incredible place to get started if you are a caregiver. That's really all of the things that I wanted to say right off the bat. If you're not aware, in my practice, I do reserve a certain portion of my patient care time to caregiver support. Anybody who is a caregiver of a primary patient of mine, let's say your person has Parkinson's disease, again, that's my focus, one of my focuses, and you are the caregiver, you then can see me independently and individually for 50% off all cost of time of service. So it is a fee structure that I created here when I joined the clinic because, like I said, personally and professionally, I do recognize the need for proper care for the caregivers, and knowing that so much time, energy, and financial investment goes into the primary patient, there's going to be a need for accessible, both financially, time, and energy for these people to be able to seek medical care for themselves. So that is a service that we offer here at the clinic through my practice. So what I want to do now is I want to shut up and I want people to ask questions, to share if you want to. We've got about 5 minutes left on the call. I am available via email. You can always email info@cdahealingarts.com. You can CC me on that, or I'm sorry, care of me, and the questions will come to me. Any questions, concerns, you just need a space to share. And then please note, we are going to be hosting these caregiver support groups on a more regular basis here at the clinic. And I really do invite you and people that you love or care about to attend. It is not for primary patients. It is for caregivers only. There will be bouncers at the door. No, but really and truly, we want to start opening up the resources for caregivers in our area. So I will pause. Kathy, thank you for being here. I see your chat.
Thank you so
Obviously, welcome to stay.
Thank you so much. I took care of my mother and she passed away. And I want to get prepared for what's going to happen to me and my husband for the future because of everything I experienced with my mom. So I'm so glad that you have this available and you shared. And one of the things that I didn't have during my mom was, all these valuable resources that you shared. And especially as a primary physician that you are, it's incredible. I'm super excited about the potential for long-term for me to think of in the future, because it was very hard to take care of my mother. I was a caregiver and I really, really wanted to do it. I didn't want to send her. I just didn't want to send her. But it was very hard, very hard. So thank you, Dr. Karin. I appreciate it.
Of course. And really what I would say to that sentiment, and I so appreciate you sharing, is take out the but and see how it feels. I really want to take care of her, but it was really hard. What if we change that to and I really wanted to take care of her and it was really hard.
Oh, thank you.
Those tears they're just there. They're so ready to say, hey, make space for me. They both can be true at the same time. And so often what I see, a primary emotion in grief when somebody is living or after they pass is guilt. And, if I had an epitaph, it would be like, remove the guilt from grief. How do we do that? And it's exactly like you said, it's preparedness. It's having these really open and honest conversations. Hey, mom, I love you so much. I want to take care of you. And this is a burden. This is really hard. And this is a lot for me. So what do I need back from you? I need some grace. I need some compassion. Our relationship is going to shift and change when I take this on. And when we have those open and honest conversations, both people are really willing to show up in a way that's really beautiful. And that relationship can evolve. You brought up something really poignant and I shared it. So it is a PDF document that you can download right from the chat window, and it's called the Conversation Starter Guide. And I do recommend every single human download it and use it. It's not written in stone. It's not a will. It's not advanced directives. It's a conversation you have with your loved one that says, where am I at right now? What's my health look like? What do I want to do? Do I want a DNR? Do I want a feeding tube? What do I want to do with my money? And you can change it next week. You can change it next month. You can readdress it every year, but it is exactly what it's touted to be. It's a conversation starter guide. So when it's really hard to approach your loved one and say, how do you want to die? those are really challenging conversations. You can go with this little nifty PDF that has fill in the blanks and say, hey, Dr. Karin, gave this to me for homework and I want to sit down and I want to work through it. It's like a workbook together. And it can really prove to be an effective way to get some of these really meaningful conversations out. And then we start to remove the guilt from grief. How do we really understand that this process that we're going through, whether our loved one is alive or passed, is this intimate, beautiful experience that we got to have together versus the like, I don't know if I did enough. Did I do it right? I said some mean, whatever the case may be, that exists so often in the process. So definitely recommend downloading it and sharing it.
I just did it.
Yay!
It's amazing. It's amazing the multitask that we can do. Listening,
Yep.
and then this technology.
There you go.
And to the chat, I downloaded it, and I want to get prepared for my kids also. My kids, how can I start talking to them about it when that time comes? So thank you.
Yeah, of course. Okay, well, if there's no other questions, I'll probably turn off the video here, and then thank you so much for sharing your story. It really helps. Like I said, it is recorded, so people tend to be a little bit shy to go on here, but the more, I think Maya Angelou said it right, the more we shine our light, the more we allow others to shine theirs as well. And I think I've struggled with vulnerability my whole life, and sharing this journey with my dad has not only made me a better physician, but it's also made me more aware of the struggles of everybody around me, to recognize like we just don't know until we start to share, and other people have that opportunity to do so. So I appreciate you. And again, I'm available privately if anybody wants to make an appointment or send me an email. And then tonight at 5:30, we will have snacks and tea. So that's another reason to come join us. But we're having the caregiver support group tonight at the clinic, and it's focused on ambiguous loss. How do we grieve the living? And then Eric Schuber of Beacon Cancer Care is also starting a cancer caregiver support group on a monthly basis through Beacon. So I really wanted to promote that here as well. So take care, everybody. Be well.
Happy holidays.
Have a happy holiday to you. Talk soon. Bye now.
Bye. Thanks.